I'm Harsha Bangura. I'm a family physician at Lakewood Health System, and I'm the program director of our new rural family medicine residency. Family medicine was the only specialty that I could really imagine myself doing for my whole life, because it's so diverse and the opportunities for practice are so broad. I'm also somebody who really values the ability to be flexible and sort of adaptable to local needs or community needs. And so the idea of being able to be the physician for a community and meet people where they are, take care of them across the lifespan, was really important to me. So that's probably the biggest reason why I chose family medicine. I love working in Staples. Lakewood Health System is an amazing organization, not least because of all of the wonderful people that I get to work with. I have a really amazing community of family physicians who really practice very broad spectrum family medicine every day. And I also have a really wonderful community of supportive specialists who work closely with us to help take care of this patient population. I love living in Staples because it's a beautiful small community. My husband and I have a lovely place on a lake, and we get to enjoy the nature and reasonably good access to recreational opportunities and to the metro area when we want to get away. So I enjoy it very much. So the Lakewood Family Medicine Residency is unique in the University of Minnesota ecosystem because we offer a longitudinal curriculum. So our residents, it's going to be a 2-2-2 program, meaning there's 2 residents per year. And the first year will be spent rotating alongside the North Memorial residents. But the second 2 years when they're here are going to be fully longitudinal, which means that really residents are going to be exposed to what it's like to practice family medicine in a rural area, the kind of moving from one thing to another, just like we do in our day-to-day and in our week-to-week. It's also going to be very OB focused. We believe passionately that obstetrics is an important part of what a family physician can bring to a community to address maternal rural health equity problems. There are 4 of us on faculty who provide C-section coverage, who are privileged to do C-sections, myself included. And we practice a rather high volume of obstetrics at our facility for our size. So that's something that we can offer. We can also offer exposure to a broad range of specialists that's kind of unique to a rural area. We have a very well-respected healthcare system that has been able to recruit specialists really at a volume that isn't super typical of a small independent healthcare system. And so I think we really can provide a robust, broad spectrum family medicine education to our residents and do it in a community that's exceptionally supportive of full spectrum family medicine. It's a very robust full spectrum family medicine clinic. Our clinicians see everybody and provide basically all of the primary care in the system. The healthcare system itself has a unique opportunity to expose residents to oncology care, rural oncology care. We have something called a rural care, like oncology care home. And so it's a unique way of bringing patients who are seeking cancer care into a wraparound service. We have several oncologists as well as radiation oncology and things like that. And this is a nationally recognized program, so that's unique. Additionally, like I mentioned, we have the very robust obstetrics opportunities, which will be a highlight of the program. The practice of rural family medicine typically is more broad spectrum than the average family physician in urban area, simply because the needs are different and how the healthcare systems are structured. So when you come to our program, that's exactly what we're training you to do. We're training you to be competent providers in the emergency room, in the hospital, on the labor and delivery floor, and in the primary care clinic. And to do that in a way that is flexible, meaning you aren't going to just be the ER doctor that day. You might also be providing some coverage to the labor and delivery floor. Because that's real life. That's how our system is set up and how many systems are set up in terms of needing to be able to respond to the acute needs that occur on a daily basis. So if you're interested in learning to be a family physician who practices at the top of the family physician license, who does all of the things that we conceivably can do, Lakewood is exactly the place that you want to be, because that's what our physicians here do. I want to acknowledge that it's always a little bit nerve-wracking, this process to choose a residency, and certainly choosing a residency that's in its infancy, being the inaugural class or one of the early classes of a residency is, I would imagine, like pretty nerve-wracking as well. But I want to really stress that this program is one that, assuming you're coming with the goal of learning to be the best family physician that you can be and really stretch yourself, skills-wise, to get all of the skills that you're going to need to be in your, go back to whatever community you want to go back to, that this program is ready to help you do that and flexible enough to allow you to do that.